There is not a week that passes by that we are not reminded of its devastating impact on our society. We have lost many loved ones across the country from opioid overdoses or opioid-related deaths. It is easy to feel overwhelmed by the extent of the problem. But before we can do anything at all to address this crisis, we first need to understand how we ended up in this state. How we got to this state. Opioids are a powerful class of prescription painkillers. Codeine, fentanyl, and Lortab are a few examples, but the full list is extensive. When used as directed by a doctor, they can provide significant pain-relieving effects to those who are in need. Opioids can also alter the part of the user's brain that creates feelings of pleasure and satisfaction, especially when taken in higher doses or more frequently than was prescribed, so the user gets a high feeling when taking them. If this goes on for long enough, the user's brain undergoes structural changes and they become physically dependent on opioids to control their pain. He or she will experience craving, anxiety, and withdrawal when not taking opioids, leading to a high potential for addiction. We define addiction as a state when the user cannot control his or her drug use, despite doing harm to oneself or others. When opioids are used more frequently and at high doses as seen in abusers, they can cause difficulty breathing and heart attacks, leading to death. In the early 1990s, pharmaceutical companies reassured the medical community that patients would not become addicted to opioids, so healthcare providers prescribed them at increasingly higher rates. Eventually, this led to a widespread misuse, and it became evident that legally prescribed opioids do cause addiction, tolerance, and death. At that point, it was too late to prevent the devastating impact it had on patients. In 2015, drug overdoses were the leading cause of accidental deaths in the United States. In 2016, 66% of all drug fatalities involved opioids, and in 2017, the opioid epidemic was declared by the president to be a public health emergency in the United States. Why we chose it as our topic. As part of Erie County in the state of New York, we've experienced opioid overdose deaths far greater than our statewide average. We've decided that addressing the opioid crisis was the foremost issue to best address the concerns of our local community in Buffalo. We knew it would be a big undertaking, so we decided as a group to target our efforts towards the high school population. Most adolescents between the ages of 12 and 17 who misuse prescription pain relievers get them from a friend or a relative. Young adults, ages 18 to 25, are the biggest abusers of prescription opioid pain relievers, so by educating them before they become abusers, we hope to reduce the rates of opioid misuse in our community. Moreover, we are especially passionate about using this opportunity to prevent misuse and abuse in our own age group. We feel that it is important to raise awareness and deter first-time opioid misuse before abusive behaviors are set into practice. We hope to inspire high school students to contribute to combating the opioid epidemic by educating their community, while demonstrating to them what pharmacists are able to do, preventing overdose by educating patients on proper use and dangers of misuse.
We have created a program, OpiEducate, that aims to address the public health emergency through educating high school students about the epidemic and the role both pharmacists and students can play to combat it. Students can be educated through opioid awareness health fairs. With our OpiEducate team, we collaborated with the University of Buffalo School of Pharmacy and Sacred Heart Academy to host a pilot fair to depict its feasibility and impact on high school students. The fair was 1.5 hours long and was attended by 35 high school STEM students. A pre-event and post-event survey was given to each student to evaluate the success of the fair in educating students. Our keynote speaker was Dr. Bob Waller, a professor at University of Buffalo School of Pharmacy and a pharmacist who specializes in pain management and who has been on multiple opioid discussion committees. The fair also had 2 educational stations headed by the PharmD students. Our Understanding the Epidemic station discussed the history of the opioid epidemic, reasons for opioid use and addiction, and showed how close illicit drugs are to prescription drugs through their structure and mechanism of action, such as with morphine and heroin. Our Role of the Pharmacist station discussed the general profession of pharmacy and the role of pharmacists in addressing the epidemic, such as naloxone education, effective counseling, and educating the general public through involvement in events such as opioid education health fairs. Next, there was a Kahoot session led by the high school members of our group, which sought to provide a fun platform to engage students and assess student learning. Lastly, the fair ended with a reflection section where the attending students were broken into smaller groups to discuss what students learned and their opinions on the epidemic. We have provided many of these resources on our website, which can be used to reproduce an opioid abuse awareness fair like the one we hosted. Our website can be reached at opieducate.wordpress.com. The front page has live updates on various program initiatives being held as well as facts about opioids. Our Set Up an Event section contains all the information needed to set up and prepare an educational health fair. Some examples of information included are posters, flyers, quizzes, surveys, and contact information for pharmacy schools across the country. Next, our PSA video will be viewed by high school students across the country and serve to educate and inspire them to undertake similar projects to combat the opioid epidemic in their local communities. The PSA video includes key statistics on the epidemic along with a brief summary of what students can do to get involved. Our resource section provides additional information that pertains to opioid abuse that pharmacists may also find useful. It includes items such as a pharmacist's opioid counseling checklist, community testimonials, and medication safety tools. Lastly, there are links to social media outreach platforms such as Facebook and Instagram to help distribute our facts and target our high school audience. Whether it is by hosting an opioid awareness week in schools, setting up health fairs to educate their fellow students, or providing outreach and assistance information to those in need of help, we believe that there is a way for every student to get involved in the efforts to combat the opioid epidemic plaguing our country.
As pharmacists and pharmacy students, we have the ability to educate our communities on the benefits and risks of opioid use and abuse. Our team's vision is to educate teenagers of what opioids actually are. We've already had great success with our first health fair at Sacred Heart Academy with some of the STEM students. Our statistics show improvements in opioid knowledge and awareness. We hope that eventually other pharmacy schools across America can use our templates, posters, and videos and take our energy into their local high schools to spread the wealth of knowledge we've begun to share.